and we are going to talk about mental health and investments in mental health. Esinam, you're welcome.
Thank you.
I hope you're doing well.
Yes, please.
Have you also started feeling the Christmas in the air?
Yeah, I've seen some decorations in some places, so I think Christmas already here. I think it has come quite early.
Quite early, yeah.
People are decorating very early.
I mean, Christmas time means a lot for a lot of us. So, do you have any childhood Christmas memories you remember you'd want to share with us?
I remember like getting new clothes, eating special food on Christmas Day. So yeah, I really love Christmas. I really love Christmas.
Your mother didn't measure your feet with broom?
No.
Oh, okay. my mother did, and every year I look forward to that. And you step on the broom, then she'll measure, and then she'll break it. Because if you follow her, you're going to do, I don't like this, I like this. So she would just go and buy it, and eventually, even though your feet was measured, you will still get oversized, a little oversized, because after growing your special class for it. Anyway, you're welcome. Let's zoom into our discussion for this morning, and we're going to talk about mental health and why we need to invest in mental health in Ghana. First off, what's your take on mental health delivery in the country? Are we making any inroads? Are we serious about it? And do we really appreciate the importance of doing so?
Okay, so first of all, I want to say that I was diagnosed with a mental health condition in 2015. At the time, I was in my third year at the University of Ghana. So this mental health condition is called bipolar disorder. It's a mood disorder. And I like to say it's a two-in-one sickness. So I have the depressive side and then the manic side. So I have episodes from time to time. If I don't take my medication, it will be very serious, but the medication helps me to be stable and everything, and to live a normal life, in quotes, like everybody else. So I would say that 5 years ago, things were not like this in the mental health space. We have tried as advocates to make noise, create awareness about mental health. And when I even look at myself, my parents have made a lot of investments in my mental health by providing me with resources. For example, I didn't drop out of school when I got diagnosed with the illness. They did well to make sure they sent me to hospital. We got the right medication. I went through therapy and all that for me to be able to graduate. And now I am living and working and going on in life like everybody else. So it was a huge investment they made with me.
Let's just find out a bit more about you and living with bipolar. How is it for you? Is it challenging?
Well, it gets better every year, but this year has been very challenging for me because we have triggers and stresses that can cause episodes to come. So I've had a lot of challenging and turbulence moments this year. So I've had a lot of depressive episodes. I've had to go on sick leaves and all of that. But thankfully, I work with an organization, Mental Health Society of Ghana, that is very understanding, and they give me the chance to be at home, recover, and come back stronger.
Would you want to share with us some of the things that get you into the depressive mood?
Okay, so when I fall physically ill, I like to say it sets off an alarm with my mental health. So for example, if I have malaria, I could just get depressed and stay in bed for days, not because I'm not taking my medication, but I'm physically unwell. Yeah.
Have you ever had manic attack?
Yes, we call them manic episodes.
Manic episodes?
Yes, so these manic episodes, I was experiencing them most of the time when I was in university, and that was because I wasn't adhering to my treatment, so I wasn't taking my medication. And I like to say mental health conditions, they are like physical health conditions. So for example, if you have malaria and a doctor tells you take your medication and you don't stick to the treatment, or you stick to it and then you later on don't take the medication well, the malaria will come back and it will come back stronger. So that's what happened to me. So I was having manic episodes a lot in my first year because I wasn't taking the medication seriously and not taking it at all at some point.
Why were you doing that?
Well, it was hard for me. Like,
you were still in the denial phase?
Yes, I was in denial, especially at the time. I didn't know anybody with a mental health condition, so I was looking at all my friends. Okay, none of my friends has a mental health condition, and I looked at the condition too as a death sentence. I will not be able to make it in life, and what's the point of taking the medication when it can't cure you, and they are saying you need to take it to be managed, and you ask your doctor, when will I stop taking it? They will just say, oh, take one day at a time. I just didn't want that. I wanted a quick fix, to be over and done with it. And I didn't know, rather being in denial would rather make things hard for me. So I was having a lot of manic episodes. And the thing with mental health conditions is that it can affect your sleep, your sense of judgment, your priorities. So by the end of my third year in university, I failed 3 courses, not because I was not intelligent, but I wasn't going to class. I had other priorities like redecorating my room, buying unnecessary things, going on shopping sprees. So that was the damage it came along with the manic episodes.
Right, but you're fine now.
Yes, I'm fine now because I am taking my medication. I'm going for therapy. I've noted my triggers and my stresses. I'm also doing a lot of self-care. So I'm just like anybody else. You wouldn't know till I tell you.
Right, that's very true. That's very true. So what is investing in mental health?
Investing in mental health means that we should look at our country and do a national survey. What would be the returns and the benefits of investing in mental health? So for example, if I want more money, I'll go and make an investment in an institution. So people don't realize that investing in mental health will bring a lot of returns. Why am I saying this? I'm saying this because I used my story for an example, how now my parents are benefiting in a way from investing in me. So as a country, when we invest in one person who has a mental health condition, there will be a lot of returns. For example, when you invest 1 cedi in someone who has, let's say, depression, you'll be getting 7 cedis in return. How is this going to happen? This is going to happen because that person you are investing in, the person is going to get well, the person is going to go to work, productivity is increased for where they are working, and at the end of the day, the GDP of the country is increased. But if you do not invest in people, the World Health Organization actually states that every year 1 in 4 people experience a mental health condition. And now that COVID has come, there are heightened levels of depression, anxiety. More people are getting mental health conditions than before. So we are actually losing a lot of productivity. But you see, mental health conditions, they will not kill you like the way malaria will kill you. So it's sort of subtle. You will not really see it till after some time. You realize that it's like more people are dropping out of school. Why is it that somebody who has tuberculosis, all of a sudden the person is not adhering to treatment? The person is not adhering to treatment. The person is not getting well because the person is depressed and they don't know how to take their medication. One thing with depression is your mood is low. You don't have edges. So for example, I had the edge this morning to wake up, brush my teeth, bath, and come here. But when you are depressed, it's like someone has taken away those edges. You don't feel the edge and the need to go about your daily activities. So it's like a cycle. If we don't invest in mental health, at the end of the day, there's going to be a lot of damage in the end. And this is not like pregnancy where men don't get pregnant. Mental health, everybody has it. Once you have a brain, you have mental health. So it's a very serious issue.
So then in what ways do you say we should invest in mental health?
So first of all, the country needs to do a national survey. When you do a survey, it will help you to know how to prioritize. So the last time a national survey was done in Africa was in Nigeria between the year 2001 and 2003. And the survey wasn't even nationwide, it was just among Yoruba speaking people. And that's when they got to know, okay, this number of people have mental health conditions, or these people are likely to have mental health conditions. So when you do that, the nation will be able to prioritize and realize that that 1% they've been allocating every year in the national budget is not enough, because there are so many people in this country who have mental health conditions. It's not the people walking naked by the street. There are so many people. Every day I go for review at the hospital, I see new clients, I see old clients, and people will keep having these conditions if priorities aren't taken. Another issue is our national health insurance scheme. The psychotropic drugs are not on the national health insurance scheme. The psychotropic drugs are the medications we take. So, for example, I take mood stabilizers and antipsychotics. These things help me to feel better. They help me to be able to live a normal everyday life. But they are expensive. The brands are there. There are many. There's variety. They are available. But they are not on the National Health Insurance Scheme. So imagine if I was unemployed. I don't have the kind of support system I have. How am I going to afford these medications? I have friends who tell me every month they budget. What is more important? Is it their food or medication? So some say, oh, as for the medication, if I don't take it, I can still live. But food is very, very important. So looking at the National Health Insurance Scheme, it should really be paid attention to. And then public education on mental health. You know, people discriminate and stigmatize against people who have mental health conditions. If you discriminate and stigmatize against someone who has a condition, they may never have the confidence, the self-esteem to pursue their dreams. For example, in 2019, I got fired from my job because I disclosed to my bosses that I had a mental health condition. It wasn't even less than, I disclosed to one boss. Less than 24 hours, all the bosses everybody got to know, and I got fired from this institution. So at the time, I was an undercover mental health advocate. I wasn't out there, I wasn't public, but I had received training from a project with the Time to Change. And in this training, they told us, look, anyone who has a mental health condition shouldn't be made to feel isolated or worthless. So that was always at the back of my mind. So if I wasn't in that training program, when I got fired, it would have gotten to me. I would have broken down, never been the same again, afraid to even apply for new jobs, because I'll be thinking, when they give me the form and I see medical history, what am I going to write? It's high time employers get to realize that, look, people with mental health conditions, they can live, they can work, they can do so many things. There are even celebrities all over the world who have conditions. Mariah Carey, the musician, she has a condition. She has bipolar disorder. We have Kanye West. All these people are living their normal lives. But because of the stigma and discrimination, people don't want to come out. People are also not paying attention to the small public education that we are doing currently. Then we also have to look at the visiting committees. There are so many laws, legislations, policies in our system in the country. They are good, but they don't work. For example, it states that no one has to be fired from their job because they have a mental health condition. But me, like this, I didn't want to pursue going through the legal way, suing where I was fired from, because it's going to be stressful, it's going to be tiring, it's going to be financially very expensive, and that's why people may not even want to go towards that line. So there's so much. Then finally, my favorite part, the media. So what you are doing this morning for me is investing in mental health. You are not giving me how should I say it? I'm not paying you financially for this service, but you are giving me free airtime to do this. So this is a huge investment. Sometimes when I'm watching TV and they are talking about mental health, the first thing that they show on the screen is vagrants walking on the streets, and people get the impression that, oh, that's what mental health is all about. They don't portray another image to make people realize that, look, everybody has mental health. You never know. It happened to me when I was 21, when I had this condition. So you never know, it could be you. So these are very serious things we need to look at. Even movies, it's how you portray your movies. You know, some movies, it's always about someone went to the fetish priest, they didn't go with what the fetish priest said, and now it backfired, and then they've lost their mind. These little things, it's high time even the directors, producers start looking at it. How can we invest more into mental health and portray another side about mental health? Social media, content creators, influencers, everybody, let me just say everybody is an investor, whether you like it or not. Everyone is an investor. It's not just the government. You as an individual, you are an investor. What the little you can do as a person. So for instance, if I take my phone, WhatsApp, I go on my WhatsApp status and I just post a picture or a caption about mental health. Oh, 1 in 4 people who experience a mental health condition. Someone will watch my status and realize that, oh, okay, this is something serious that we should look at. So it's not just the government alone. It's high time we start looking at ourselves and taking things very seriously.
One would say that why should we do this? Why should we spend time and energy and resources to invest in mental health?
So, like I was saying, productivity. If you don't invest in mental health, a lot of things are going to happen. So, for example, I feel like the government is afraid to invest into mental health because we have other sustainable development goals we are looking at. We want to reduce poverty, we want universal health care, we want gender equality. All these things are good, but if you invest some money in mental health, your returns will be all these things I'm mentioning. Increase, how do I say this? So for example, me like this, I am working today, I'm earning an income. I can give back to society, help others, my family members, my friends, because someone invested in me. So it's just little things that will at the end of the day bring us back more returns. The developing countries we are talking about, is it developed or developing countries? Not like Ghana here.
Developed.
I mean,
they are already developed.
They are developed. So those countries, they invest a lot into mental health. Though people don't know, they invest so much into mental health that they are getting the returns. So for example, over there, if you're having a mental health crisis or a situation during COVID like this, you could easily pick up your phone or text someone, a support system, a therapist or someone, and they will get back to you. So if I'm experiencing anxiety, depression, when they get back to me, they help me go through my mental health journey, my road to recovery, and I am well and I am working. Is it not a good thing? It's a very good thing. And we don't want more people to be vulnerable to sicknesses. Look at something like substance abuse, drug abuse, HIV, obesity. You know, sometimes what leads people to do these things is from mental health conditions. So if I am depressed, I'm not happy, I'm having a lot of emotional pain, it can lead me to harm myself. After I harm myself, if I meet someone who gives me a little joy, a little excitement through drug abuse, I'll go and overdose on those things and I'll end up dying. When I die, my family will be affected. Everyone will be emotionally affected. From family, nuclear goes to extended, and it keeps moving on and on and on and on. So it's a huge deal. This obesity I'm talking about and anorexia is when you starve yourself. How do people end up there? Even little comments. You go for, let's say, a funeral or a party and say, hey, you have grown fat, so
you are still eating.
And I'm still eating. You know, someone will just make that single comment. It will just affect someone's mental health. They will end up with a condition like anorexia. I'm starving myself, I don't want to eat. I don't want to eat. Then they'll be counting their calories every day. They would just end up isolating themselves from the world, and they will not end up being productive. If there's someone in school, they may not even be performing well in school. And all these things I'm saying, it's not grown-ups I'm talking about. Even little children, I always say that even if our schools, we have a non-scoring subject like mental health, like the way we have PE. People will get to know from their onset, from childhood, what mental health is all about. They'll get to know their conditions, their signs and their symptoms. If, let's say, I had known when I was a child about mental health, I don't think I would have stressed myself out about some broken hearts I got when I was in university, and I would have ended up here. You see, so if little things could end up, they say what, the little foxes spoil the vine. So that's what I'm talking about this morning.
So I had wanted to shelve this for later, and I received a couple of questions. And since you have brought up the broken heart issue, let me ask you, then we can move on. So Nana sent a text and want to know how men see you coming out openly. Is it not affecting your relationships with the opposite sex? And if it's affecting you, can you share, and how are you dealing with it?
Okay, so I tell people, when you are diagnosed with a mental health condition, it doesn't mean you should automatically become a mental health advocate. I was diagnosed with a condition. For 4 years, I wasn't an advocate. I wasn't out there. I wasn't sharing my story publicly. I healed privately before coming out in my 5th year and now my 6th year. It's, apart from the fact that I got fired, now it doesn't really affect me. A lot of people know I'm an advocate. They can't stigmatize or discriminate me against what I do, because I have my own self-awareness, and that's what brings me my salary every month. That's what brings me joy. That's what brings me happiness. So it hasn't affected me in any way. Initially, when I was coming out, some of my extended family members who loved me so much were concerned that this thing abroad, if you want to become an advocate, it's okay, but here people will stigmatize against you, discriminate against you. So they were telling my daddy that he should talk to me. Maybe I don't know what I'm getting myself into. But when everybody has seen the returns now, it doesn't bother anyone. I'm actually dating. I'm in a relationship. My boyfriend is aware. He has always known from the beginning about my condition. He has been very supportive. He has gone with me for some of my therapy sessions. He has been with me even when I was admitted at the psych ward. He visited me and all that. It doesn't bother him. And the thing is that I see my mental health condition as an invisible suitcase, something that I have to go through life with. So whilst people, life is a journey. So whilst, let's say, all of you here in the studio are running, I'm also running with you, just that I'm carrying an invisible suitcase. If I have to do something in life, you people put in the effort, but I have to put twice the effort into it. You see, when I came this morning, you asked me that I had to get here early. So yesterday like this, I knew I was coming here, so I had to take my medication at 7 p.m. in the night, because if I don't take the medication early, I will not wake up early, and I'll wake up early, be here and be very drowsy. But I don't think anyone in the studio had to think about medication and all those things.
I only thought maybe you live at the other side of town where there will be traffic, so you decided to come early.
That is a factor, but the medication is a huge factor. So I have to do a lot of this thought processing. Every month I have to budget how much I'm spending on medication, how much I'm spending on other things. And the medications are expensive. I'm not going to lie. They are expensive, and you need them. It's like the way a hypertensive or diabetic patients will need their medications. I also need them because mental health conditions are chronic. So to answer that person's question, it doesn't really bother me. If it bothers you who is in a relationship with someone, I think you need to read more about the conditions. When you read more, you have more understanding, and you have more patience and love for the person you are in a relationship with or dealing with. I think that where I got fired from, if they had had more mental health awareness, education, they wouldn't have fired me. They would have realized that I can perform just like every other person, but they will not give me extremely stressful tasks. So what I see mental health awareness as like the glasses that you put on to be able to see clearly what's going on.
I'm really impressed with the answer you have really given to it. If we look at certain conditions or diseases like malaria, you see that there's so much investment for its treatment and so much investment for awareness creation and the like. For mental health, we don't really see so much of that. How can we mobilize funds so we can invest that into mental health treatment and awareness creation?
Okay, so like my organization is a non-profit organization, other civil society organizations, we have been promoting and investing in mental health by getting funds from donor partners. You know, when you are getting funds from outside the country, it's not always something you can rely on, and you wouldn't get, let's say if I want $20,000, I may not get that amount of money, and it's a challenge for us. That is why I said that as individuals we can do little things. Malaria, it kills, and malaria, like the mosquito bites you, you get it. Like, I'm sure everyone in this studio has had malaria before, you see. But with mental health conditions, it takes years. If, let's say, like for example, when I started experiencing symptoms, we started going to churches. So pray for me, whom the Lord has set free is free indeed. It works. But I tell people, look, if your car is spoiled, you send it to the mechanic, not the baker. So if my parents had not tried, I'm not saying church is bad, church is good, God is good. But if my parents hadn't gone to send me to a professional, my condition would have worsened by now. And so it is high time that it's not only government that takes charge. My friend was telling me yesterday that the media is like a huge mouthpiece. You can speak here in your radio in Accra, and someone in the north will be listening. So the media is one of the platforms that I think it's high time they start considering mental health stories. I was called to a media house on a Sunday afternoon, news time, to share my lived experience and my thoughts on people being abused in prayer camps. When I got home, I was thinking to myself, how many people will be watching the news on a Sunday midday? People after church, they are going to have fun with their families. It's not a bad thing, but the timing, I think, it was good. I'm grateful for that. But the timing, I think, was important. Breast cancer awareness, how come all of a sudden it's a big thing? When I was little, I don't remember people wearing pink ribbons, breast cancer awareness. I don't remember it's been a huge thing like that, but it's there now. We like this World Mental Health Day celebrated in October. World Bipolar Day is also celebrated in March. Cerebral palsy is celebrated in some other month. World Suicide Prevention Day is celebrated in September. All these things are there. We try to celebrate these things, make noise. But if the funding is not there, you cannot do so much. If, let's say, there was funding opportunities in Ghana, we allocate funds, like the way sometimes we do these blood drives, blood transfusions, and we allocate funds for mental health screening. People will get to know their true status. Someone was telling me he thinks every institution, corporate institution, wherever, school, they should start doing mental health screening at the end of the month. You will see that things will start popping up. Someone told me once that when her mother or father passed away, she used to sleep with the funeral booklet all the time. She didn't realize there was anything wrong with it till she had to travel and the booklet wasn't there. She couldn't sleep. That's when she knew that something had affected her mental health. So it's high time that we start trying. Me, like this, if I had to go, I used to be a teacher, if I had to go back to the classroom, I think that I would have been more patient with my students. If I notice something off, I'll try to pass it on to my senior staff for them to know what is going on, than to sit down and wait for something to get worse. Imagine if you have malaria when you are in class 1, you don't treat it till you get to like SHS. It will become very chronic. So I would like to say, as individuals, we should all try, be a good friend. Sometimes when we are in university, people fail their courses, they try to complete suicide. How did the person end up there? Didn't the person have friends, roommates? You will see the signs and symptoms. If you never read, you will never know what is wrong with someone. So we should all be investors. It's not about always interrogating people, but being a supportive person. Someone asked, when I got fired from my job, a friend of mine, she asked me that, like everybody was saying, sue this place, sue that place. But she asked me, Esnam, how are you? I mean, how are you really doing? Not the Ghanaian sort of, how are you? I'm fine. We don't progress from there. We don't ask more questions. And I'm not saying that we should probe a lot, but let's try to find out if people are really, really doing well. Yeah, if they are really fine, not how are you, I'm fine. And you know, when you go to church, it's even worse. How are you? I'm fine by the grace of God. Sometimes people have to put up acts, because in society, what I feel for the most is the men. When it comes to men and mental health, it's a whole other topic on its own. Men are taught from the onset, when you're a little boy, you don't cry.
You don't show emotions.
You don't show emotions.
Vulnerability.
Yeah, you don't show all those things. Someone told me when they were in SHS, if the boys find out you went to see the school counselor, the way they'll laugh at you, you know. But people are going through things. I think senior high schools in Ghana, it's a very tough time to be. It's a tough season to be in, because those are the formative years. Adolescence is there. You are dealing with so many things, and sometimes you are far away from home, stuck in a boarding school. The only times your parents get to see you are during visiting hours. How many hours are those? How would they uncover certain things? So even in schools, if let's say as teachers, if you can't afford to get a professional counselor, if a teacher decides, I'm going to read about mental health, I'm going to train myself a little. For example, we have something called the WHO quality rights training. It's quality rights because we believe that everybody, if you have a mental health condition or you have mental health, which is everybody, you have rights. So for example, if I go to a psychiatric ward and they want to administer medication to me, the mental health professional must tell me, Esinam, I'm giving you this and that medicine. It will make you feel sleepy in 30 minutes. This is how you feel. But people don't know about quality rights. So they go to the hospital, people are abusing them, and they have no idea that their rights are being infringed. So, but basically all I'm saying is that everyone is an investor, everybody, because you have a role to play in society, in your family, with your friends. We are all investors, whether we like it or not.
Let's look at stakeholders. Okay. You have already mentioned the media and other stakeholders. What should be the programs and policies that we should put in place so that we are making a conscious effort, we are deliberate about it, we are intentional about investing into mental health?
Yeah, so for example, this national health insurance scheme that I was talking about, it's a debate we've been having every year, back and forth. It's high time that these psychotropic medications are put on the scheme. Why am I saying this? Poverty rates are twice higher in people with mental health conditions. And I've seen it, like the evidence. Most of the people I know with mental health conditions, they are unemployed. They are caregivers. Sometimes the person taking care of them, someone is epileptic, they will have to stop their work and come home and come and take care of that person. So that person too doesn't have money. So the poverty is higher. So if these medications are put on the scheme, people will go to the hospital. They will even be willing to go to the hospital. Some don't even want to go because they know when they go, they'll mention some medication price that they cannot afford. It's high time they are put on a scheme and people will be able to afford. Some people have even been saying, why don't we just make mental health free? Something free everybody can access. If something is free, people will get up and have the confidence to go in there. Now let's talk about the government. I was talking about this non-scoring course, Ghana Education Service. What about infusing it into our curriculum so that people will know from the beginning what mental health is all about? Then let's look at please hold on.
Right. Okay, so we are here spending time with Esinam Jra, who is Project Coordinator, Mental Health Society of Ghana. And she's also shared her own lived experience with us with mental health. Yes. Esinam, you got what you were looking for?
Yes, I've gotten what I'm looking for. So let's address the mental health impacts of COVID-19. You know, when COVID came, I was so amazed at how come we were able to locally produce sanitizers. You know, it's amazing. PPEs, people were sewing nose masks, and the government was emphasizing on wash your hands, sanitize, and wear your mask. It's all good. But what about if this noise was made about mental health? COVID has really impacted a lot of people's mental health. People have lost people they love. People have also become paranoid, very, very paranoid for the reason that COVID came. So I would wish the government to look at the impact of COVID on people's mental health. It's nice that we've done all these other things, but let's say we have a support line, a toll-free line that people can call and actually get help from. If they need further help, they can access other centers. Then let's also look at the government making the job of mental health professionals an attractive place to go to. Me, I never knew being a psychologist was a job. I didn't know about psychiatrists. What I know is doctor and nurse. People are not aware about, like, actually you can go into a profession where you can help people's mental health. They should make that area attractive, because there's a lot of stigma attached to it. I've heard doctors say when they were in medical school, people were laughing at them that they are the doctors who take care of the mad people. And I also think that these professionals, they should also be compensated. Social welfare workers are those people, they are the ones that I feel for the most. I don't think they are motivated enough. Me, I told someone recently that I wouldn't want to go into social welfare, that kind of job, because it's very stressful. For example, the district assembly common fund, the 3% that is allocated to mental health and disability, how to even get those funds for people you've registered in your community, your district, is very challenging. And when the money comes, sometimes I know someone like legitimate told me that it's not easy at all. If you don't follow up, you'll not get the money. When you follow up too, it's like a rotation. So last time we gave the money to someone who needed a prosthetic leg. Now we need to give the money to someone who has a hearing impairment. So it goes on and on. What time would they come to someone who has a mental health condition? And the government, some of the people who work in the government don't even know mental health conditions are psychosocial disabilities. They don't even recognize it as a disability. They don't know, they don't recognize, they don't know. And when they are making their plans, prioritizing budgets, they don't even remember us, because to them we don't exist. We are not there. Unless unless you have seen someone with lived experience, you would not know. Me, before I had this condition, I never thought about people who have mental health conditions. I never thought about them. I never knew them. I have an uncle who lost his mind because of substance abuse. I was thinking that, oh, that thing is far away from us. It will never happen again. Yes, it will never happen again. But now I have a condition, and now I have to make the effort to make sure that no one else has the condition by supporting people. It's not about bringing some big money. That's the misconception people have. Sometimes people in government have that. We are asking for big money. We are not asking for a huge money. We are just asking for baby steps. That's all we are asking for. Yeah.
So then there's a call to action for all of us to be involved, to play our roles.
Yes.
We don't need to physically invest money, but we can invest our time, our attention, our care, our love, empathy towards mental health.
You know, there are some things money cannot buy. If I go to the hospital and a nurse treats me very nicely, money cannot buy that one. Yes, you get paid and everything, but that kind of empathy is something that if I'm a minister and I have empathy, when I go to parliament, I'll be pushing the agenda for mental health. Now we've had to even call action towards certain ministers, MPs, to tell them when you go to parliament, push agenda push the agenda on mental health, because it can easily be forgotten. There are other things people are looking at, like malaria, HIV, tuberculosis, COVID, you know, and COVID is now the biggest one. So it's serious.
Esinam, thank you so much.
You're
I think that for me, you have awoken something in me that I'll make intentional efforts to invest in mental health. And I'm sure that for everybody who has listened to us today, you are also charged up. Together we can do it. We don't need money to do it. We can just use the things around us and the people around
everything
us.
Is a resource.
Is a resource. Thank you so much.
But we need the money too.
We need it, definitely. So thank you so much, Esinam, and all the best.
Thank
I
you.
really admire you.
Thank you.
Your passion and everything.
Thank you.
You're doing a good job. All the best. Right.